Hi, for this week's clinical conference, we have AR, who is a 19-year-old male with a past medical history of anorexia nervosa, presenting with severe bradycardia. He has been struggling with his eating disorder since the 11th grade in India and where he previously lived. And 3 years ago, when he was overweight, he started to run and calorie restrict to lose weight, which progressed into an eating disorder. So he continued to restrict his intake, and it worsened with the pandemic. He reports losing 110 pounds. He currently weighs 96.8 pounds and he is 5'11". And AR was admitted to Mott's Children's Hospital for eating disorder and the refeeding protocol. So on assessment, we went and we visited the patient on the unit while he was admitted. And the patient says that he's been doing well with eating meals. He has a good appetite and he's been looking forward to the food when it comes. He's denying any complications such as stomach pain, nausea, or bloating after meals. He's remaining compliant with the eating disorder protocol and has been taking in 100% of his food, and he's requiring no supplementation. He's described his mood as good, and however, he is experiencing some anxiety after meals and snacks related to the fear of gaining weight, specifically in his face. He's worried that he will no longer be able to visualize his cheekbones after weight gain. The patient does, however, understand that gaining weight is a part of the refeeding process, and he is accepting of this. He is also struggling with body checking, specifically his cheekbones during bathroom breaks. He was observed to spend an extended amount of time in the bathroom body checking, requiring redirection during our interview. And we offered the intervention of covering the mirror in the bathroom while here in the hospital, but he refused because he says that he wants to make the conscious decision to change. He's also struggling with the bed rest order. The doctors don't want him to be out of the bed at all because of the severity of his eating disorder, and he's having a hard time with that because all there is to do is just lay there, watch TV, and study. This patient is a full time student at the University of Michigan and he is studying computer science. So, this patient, since his admission, has lost weight. He has lost 1.2 kilograms since admission with a current weight of 44 kilograms. Over the past 24 hours, he has had a heart rate ranging between 28 and 44 beats per minute, and a blood pressure ranging between 88 over 29 to 108 over 52 for his blood pressure. On assessment, the patient is lying in bed, dressed in a hospital gown. He's very calm and pleasant, very cooperative during our interview. He was observed also to have some rapid foot tapping and was asked to stop with his foot tapping for concerns of energy utilization. So for our intervention, what we did was we did some eating disorder education, and we asked him to write a letter to his eating disorder, and then his eating disorder to write a letter to him. And that is a exercise that we do to help our kids to understand the difference between their thoughts and their eating disorder's thoughts. So for his mental status exam, his behavior, he was sitting in the bed, dressed in a hospital gown. His motor activity, he had some feet tapping and some knee movements. His speech is fluent, amount was normal, rate was regular, tone calm, and volume was normal. Mood is good. Affect was happy and congruent with his mood. Thought content showed no signs of obsessions, delusions, or compulsions. Thought process was linear, organized, and goal oriented. Insight was moderate, given that he felt that he didn't need to continue like a partial hospitalization in the outpatient setting. Judgment was also moderate. Diagnosis: Axis 1 is anorexia nervosa restrictive type, Axis 2 is deferred, Axis 3 is bradycardia and hypotension, Axis 5 is school. He's a student and has not been able to go to school because of his hospitalization, and Axis 5 is 40. So the plan for this patient, he has a PRN for hydroxyzine 25 milligrams 3 times daily with meals, anxiety related to meals. And I also found an article saying that a small study found hydroxyzine to be highly effective in treating generalized anxiety. All right, thank you. Let me know if you have questions.